Upstart, we have some big news coming in. Nurse tests positive for COVID-19 in Bengaluru. Nurse contracted virus from a private hospital. The doctor, in fact, contracted this virus from a private hospital is what is being said at this point in time. The private hospital has been sealed after doctor tested positive for COVID-19. The nurse, who is patient number 420, contracted the virus from patient number 208. Two positive COVID-19 cases reported from Bengaluru today. 54-year-old man from Bomanalli tests positive for COVID-19. While officials are at this point in time trying to trace the primary and secondary contacts of patient number 419. More details emerging pertaining to the two cases emerging from Bengaluru city. We're talking about how a nurse has tested positive for COVID-19 from a private hospital doctor. For more on this, I'm being joined in by my colleague Ashish, live from the newsroom. Ashish, we're talking about a situation where the government is all set to pass an ordinance to protect frontline warriors from physical harm, physical attacks. But on the other hand, the ground reality is slightly different. It seems as though the frontline workers, the doctors, the healthcare workers, the nurses need better and more PPE kits to really arm themselves from the virus. We're talking about how a nurse has contracted COVID-19. What more do you have for us?
Absolutely, Adarsh, like you've rightly been saying, it is not just that one particular way, the physical attack that we're talking about. That is not just the only way that the frontline warriors are actually putting their lives at risk, but also the fact that, despite having all the necessary equipments, they are somehow one way or the other contracting the virus across, various hospitals across the country. Now, one of these places was a private hospital in Bangalore where you had a case coming up and immediately the hospital was sealed down a few days back. Now, it has come to light that one of the people there, one of the nurses there, in fact, has now tested positive, and she got it from a patient number 208, who we believe is a 32-year-old doctor who was working at the same private hospital, and that is probably where she's got the virus from. So that is one of the cases that has actually come from Bengaluru at the moment, and there's one more case that has come of a 54-year-old resident who also has contracted the virus. Where did he get it from? That is something that is still unclear, because that is again a case of Sari, and the officials are obviously trying to trace the contacts and also the travel history. So these are the two cases that have actually come out from Bengaluru today. Patient number 419, the 52-year-old man who has now tested positive. There is no information about where exactly did he contract the virus from. It is just known that he was suffering from SARI and has been isolated at the moment. And the second case, patient number 420, in fact 28-year-old female from Bengaluru who contacted the virus from patient number 208, who is now believed to be the doctor at the private hospital where this woman was working as a nurse. So clearly going on and highlighting how frontline warriors are actually putting their lives at risk, for the nation, and their efforts need to be understood. And even the Home Minister today, after his meeting with all of the medical associations, went on to say that he would make sure that the lives and the safety of healthcare workers and frontline warriors are of utmost importance and will be taken care of throughout the country.
Now, Ashish, when we talk about the cases that have emerged today, we also get to see as to how the severe acute respiratory illness has made its presence once again in Bengaluru city. And what about patient number 419? We're given to understand that the contact tracing of this very patient is underway. Are we talking about another containment zone probably in Bengaluru urban, given the fact that you'll have to go ahead and trace quite a few contacts?
Well, absolutely. Now, again, a lot of these cases that are coming up these days in Bengaluru, you have cases of SARI, ILI, and also the fact that a lot of people who are actually testing positive are asymptomatic. Now, that is something that the authorities are carefully looking at, because, of course, if someone's showing symptoms, if someone's displaying any sort of symptoms, they can immediately quarantine themselves. Immediately, there is an alert, and even people now have that basic sense to actually stay away from those kind of people. But when someone is asymptomatic, they actually go around traveling, they meet many people and also step out into the open, which makes it even more dangerous. So, tracing all of these people becomes a big headache for the authorities. Even, not just these cases that we've seen today. In fact, one of the super spreaders from Bengaluru, that is patient number 252 from Tipunagar, also now it has come to light that that person traveled to Padranpura while he was asymptomatic. And, there are reports that either he contracted the virus there or, he had the virus earlier on. Whatever be the reason, whatever be the cause, he he had traveled to Padrainpura and had come back to Tipunagar, and on the way you have Mysore Road and also several other wards, lots of people traveling around, commuting in that region. So that has again now put authorities on a high alert as to how many people did he actually come in contact with, how many shops did he visit on the way, and what was exactly the activity that he had, because there is another patient number 52, who is still alive, and he's gone ahead and told authorities about where all he went, and the authorities at least have sealed down those places. But this patient number 252, passed away, and that is why the authorities now have to rely on CDR, that is the call data records, and have to actually go ahead and find out. So these are the cases that we have been bringing into focus, the ones with SARI, ILI, and also the ones where people are still asymptomatic. These are the dangers that pose these pose the biggest dangers to everyone at large, and these are the cases to look out for, others.